Welcome to Season 3 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Josh Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former Secretary of Maryland's Health Department. Our goal is to bring scientific evidence and experience to the public health news of the day through informative interviews with scientists, community leaders, policy experts, public health officials, clinicians, and more. If you have ideas or questions for us to cover, please email us at publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak with Dr. Morgan Katz, a geriatrician and infectious disease specialist at Johns Hopkins, and with Shauna Dell, the lead infection control advisor on the outbreak team of the Baltimore City Health Department. Our topic is COVID-19 in assisted living facilities, including the special challenge of COVID-19 and Alzheimer's disease. If this topic is of special interest to you, consider taking a free new course now online at Coursera.org. This course was developed by Johns Hopkins and Baltimore City, specifically to help assisted living facilities keep their residents safe. Let's listen. Thank you so much to both of you for joining me. And I'd like to start with you, Dr. Katz. When we talk about assisted living facilities and the challenge of COVID-19, a lot of people might think of the challenge of COVID-19 in nursing homes. But how do assisted living facilities differ from nursing homes in ways that are important for COVID-19?
Yeah, thanks so much for having me here, Josh. I think there's been a huge focus on nursing homes throughout the course of this pandemic, but the reality is that assisted living facilities have also had to struggle with a lot of similar issues that the nursing home struggled with, but also some different issues as well. So first, just to sort of define the difference between assisted living and nursing homes. So nursing homes, you're usually going to see it's usually a more medical community. And in saying that, you have a regular nurse on site, a little bit more medical staff. You have the ability to do infusions and higher medical care. Whereas in assisted living facilities, you usually have a lower acuity community. There's often a lot of assisted living facilities have significant proportion of memory care residents and typically have a little bit less medical oversight in terms of RN presence and physician presence.
So it has some of the same challenges in terms of people at very high risk, but maybe not as many resources as a long-term care facility would have.
Exactly. So not only not as many resources, but also less guidance. So we really have seen less directed guidance towards assisted living facilities, even though they're dealing with a vulnerable population in a congregate living facility that is requiring close personal care from staff members that are coming in from the outside community.
God, I want to turn to you, Shauna. In Baltimore, where you work on the outbreak team, have you seen outbreaks at assisted living facilities?
We've seen several outbreaks within assisted living facilities. Like Dr. Katz was saying, these settings tend to be a little less resourced than a nursing home with a little less guidance. Especially in Baltimore, most of our assisted living facilities are very small, which tends to mean that they have less room to cohort and things like that. So.
In other words, they couldn't just separate the patients who have COVID from the patients who don't very easily.
Exactly. That's been a huge barrier at preventing the spread within assisted living communities here.
I imagine that some of the nursing home guidance really doesn't apply to very small assisted living facilities.
I think it applies, but it's a lot harder to implement, and there's a lot less targeted guidance for facilities that are smaller.
What have you done with the City Health Department to try to bridge that gap?
Yeah, so we've really been working with assisted living facilities to go in and really figure out their cohorting strategies in a situation like that. We do in Baltimore have a couple of other resources, such as the Triage Respite and Isolation Center at the Lord Baltimore Hotel, as well as the Convention Center. So sometimes we will recommend sending people from assisted living facilities out to other places where they'll be able to isolate outside of the facility. We also will work with the facilities to figure out living arrangements that might not be something they would do during a normal time, but the Office of Healthcare Quality here in Maryland has allowed for some rooming arrangements during an outbreak that would be different than a normal time.
Could you give an example?
For example, most assisted living facilities, you're not allowed to have 3 residents per room. The max is 2. However, in certain situations, we've worked with the facility and OHCQ to move a resident to have a 3 people in a bedroom situation during a quarantine or isolation period. Or another one would be residents. You're not allowed to have a residence room in the basement. And again, some places have an extra room in the basement, and we've been able to, for a short period, utilize that space for cohorting purposes.
Dr. Katz, you mentioned memory care. Can you explain a little bit more about the challenges of controlling COVID in an assisted living facility that's focused on memory care?
Yeah, absolutely. And I think that this is something that isn't addressed quite as much and has been a specific challenge in a lot of these assisted living communities. So a lot of the communities will have whole memory care units. And we have seen in our experience that transmission in these settings is really rapid. And the reason for that is it's extremely challenging to isolate these residents to their room because of cognitive deficits. It's hard to explain the reason for isolation and to really enforce mask wearing and keep them in their room. So because of that, we've seen issues with transmission, and there really aren't. There are some strategies, but it has been a challenge sort of across the world, I believe.
So what do you recommend?
So there's a few strategies that we have actually gleaned from some experts in Alzheimer's. Some of them are you actually can enforce mask wearing and encourage mask wearing with just role modeling, having the masks on, having them available, and being proactive in that way. In terms of physical distancing, there are ways to really provide visual cues, make congregating less possible. So really just putting one chair at each table, making sure that you only have residents out in small groups. And then if all of these things are not possible, actually trying to remove an infected resident and try to get them in a separate area until they've completed their transmission period is really the safest way to go about this.
Got it. Now, I also imagine that changes like that, other kinds of changes, really can disrupt the normal activities of an assisted living. And, we've heard these just very sad stories of people being isolated in nursing homes. And I can imagine that that's a risk in assisted living as well. What are the strategies that you recommend to try to reduce the mental health harm from the COVID-19 preparation?
Absolutely. And this is something, that we are continuing to see, unfortunately, especially in some of these memory care residents. So really trying to continue the connection with family members as much as possible virtually with outdoor visits, trying to do I've seen a lot of facilities and communities doing what they can to try to maintain some level of normalcy in these residents' lives and also to keep it fun. So doing outdoor gardening activities when possible, spa days, wearing the masks and separating people, but trying to, get through this time together. So there are some really interesting strategies that many different communities have employed in that way.
Got it. Now, Shauna, I know that Baltimore City has teamed up with Johns Hopkins to put together a course for assisted living providers. What do you hope the course accomplishes?
Yeah, we're really excited for this course. And I think that it'll accomplish a couple of things. The first one, I think, is that it's just very informative and it gives a lot of background information to assisted living administrators. And the second one, I think, in terms of especially infection control, is that it really takes infection control guidance and makes it applicable and approachable for assisted living facilities specifically, which is not something that we've seen with a lot of other curricula.
Got it. And Dr. Katz, I know you're one of the faculty in the course. Do you think this might be helpful to family members who are wondering about what the best practices are for assisted living where their mothers or fathers might be staying?
Yeah, I do. And we actually have a lot of guest speakers that I think are excellent that we have included that specifically talk about strategies to improve care of assisted living residents and to help work together to get us through this time. And again, we really is focused on assisted living. So we're trying to get to the places that are smaller communities that have a sort of different situations than you would see in the guidance coming out for nursing homes. We're trying to really give them some tailored guidance to get through this.
Got it. Now, not too far on the horizon are vaccines for COVID-19. And nursing homes may be the top priority or one of the top priorities, but pretty soon vaccines will start coming to assisted living facilities. And I wonder whether you may have some thoughts about the challenges that vaccination will pose or key things for policymakers to keep in mind. Dr. Katz?
Yeah, I mean, I think our one concern really is making sure that we see uptake by the staff and the residents, that they are willing to take the vaccine. Fortunately, I think CDC, Walgreens, and CVS have worked together and have a pretty good plan in terms of distribution and documentation of vaccine administration. I'm hoping that works out. But at this point, for the assisted living communities, I think the big thing is really to get buy-in, make sure that their staff is excited about the vaccine and wants to take it. And then beyond that, making sure that we still continue these core infection prevention principles, even during this vaccination period, to make sure that people aren't thinking they're good to go once they get the vaccine, and that we continue to protect ourselves until we see an improvement in transmission.
Got it. And Shauna, maybe I'll give you the last word. What's your key message for assisted living facilities at this moment? Here we are at the midst of so many cases, but at the same time with the vaccine around the corner.
You gave me the hard one, John. I think just infection prevention is key. I think we're all waiting and very cautiously optimistic about the vaccine on the horizon, but we have to get there first. And I also just want to really thank all of the assisted living facilities for what they've been doing. They've been putting in such a monumentous effort to keep their residents safe during this time. So keep masking, keep physically distancing, and hopefully we can get back to maybe something a little bit more normal soonish.
Good. Well, I think I really appreciate both of you joining me. This is really a difficult time, but I do think that following the guidance in this great course, vaccines coming around the horizon, we're not stuck where we are forever. And hopefully we really will see a return to what we remember as normal sometime, maybe even in 2021. So thank you both.
Thank you.
Thank you for having us.
Public Health on Call is produced by Josh Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Spencer Greer, Niall Owen McCusker, C.N. Oates, and Matthew Martin, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo and Neiman Outland. Social media support from Brenda Haggader, Grace Holes Fernandez, and Caroline Wong. Thank you for listening.